So we're here with Deb today to talk about her experience in our office with Sedation Dentistry. And Deb came to me and she wanted to have some bridges done in the back of her mouth, and she's always had a little bit of a problem with anxiety. So Deb, we talked a little bit about you having the bridges done in one visit, and you were concerned about your ability to stay open that long. But so tell me, kind of when I mentioned the sedation, why you made the decision to go ahead and do that.
Well, it just seemed like it would be a process that I would still be awake and aware of what was going on, but I would not have the feeling of the mouth being open for so long, and you know, having people in your face all the time, it's kind of intrusive, you know, when you have a long period of dental work done.
Yeah.
So that's what I really wanted mostly. It wasn't more so the pain, because I've never been hurt by a dentist, but I just would feel more comfortable if I could, you know, not have to be so aware of everything. And the noises too. Right.
And just many times when patients need to have a lot of dental work done, they don't realize how much stress and anxiety can be reduced by them just having sedation and being relaxed a little bit more. So tell me about, through the procedure, how it was for you, and do you remember much of it? So tell me a little bit about how that was.
It was like I had 2 or 3 glasses of wine. It was actually really comfortable. I could hear everybody talking, and I could hear, you know, what was going on, but it didn't really bother me, you know. So it was a very comfortable experience. It wasn't anything that, you know, I don't really remember parts of it, you know, coming and going, basically.
Yeah.
Like leaving my house in the morning and then leaving here, I don't really remember much of, but I remember being in the chair and being aware of that they were doing the work, but it didn't really bother me.
Yeah, and that's the case with sedation, is that the medications that we use has an amnesia effect to patients. I mean, they're awake and they're there, we speak to them, but they just don't remember any of it, and that's what's so nice about it, because even getting the injections for the Novocaine, they just don't remember it. They just, you know, you're numb, you're comfortable, you just don't remember it. And so that's why it works so good with people with high anxiety. Right. Now in your case, you were concerned about being able to stay open so long, and I assured you that if you get sedated, that really won't be a problem. And in fact, it was not a problem for me to work on you at all. So how was your jaw the next day? Was it okay?
I felt great the next day. I really did. It made no difference to me. I didn't feel any difference from before I got the work done, you know. And I have a very small mouth, so to have my jaw open for that amount of time always bothered me, you know, but it didn't at all in the chair, and I felt great the next day.
Very good, very good. So I guess my final question for you would be, if you had a long procedure to do again, would you do that? And also, would you recommend that to somebody that has a fear of dentistry?
Yeah, if I had to get a procedure done again, hopefully I won't, because none of us, if we have to get that type of work done, we don't want to, but I would definitely use it again, and anybody that has any type of anxiety with the dentist, you know, I would definitely recommend it.
Very good.
It's definitely worth it, and, you know,
that's what you did. Yeah, very good. Well, thanks for sharing your story with our viewers, and I just want to thank you again for coming in.
Well, thank you.
Okay, very good.